Hi, I'm Dr. Michael L. Johnson. I'm a board-certified chiropractic neurologist. I've been in practice in Appleton, Wisconsin since 1983. I'm the author of this book, What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. Yes, I wrote the book on vertigo, dizziness, and balance disorders. I also consult with over 1,000 chiropractors across the country. You can look at testimonials on vertigo and dizziness at our website at lifechangingcare.com. That's all one word, www.lifechangingcare.com. You will see all the doctors in my program and their patient testimonials. What I teach them is about what I'm going to share with you today. Okay? So what makes us different from every other doctor you've seen? And I don't care if you've got vertigo, balance disorders, lightheadedness, dizziness, brain fog. We treat you metabolically and neurologically, right hand and left hand, metabolic and neurologic. And what I'm about to tell you, you may or may not have heard from other doctors. I doubt it if you've heard it from anybody else. So you're watching this DVD because you or someone you love is suffering with a balance disturbance, a balance disorder. And I'm here to tell you that we don't leave any stone unturned when it comes to treating your condition. So how do I successfully treat vertigo, dizziness, balance disorders, lightheadedness? Like I said, we treat you metabolically and neurologically. Let's talk about the metabolic side. One thing we're going to do is we're going to get complete blood work. And I know you've had blood work probably. Everything was normal. Keep in mind that there are lab ranges that are very broad and there are optimal ranges that are a lot narrower. Okay? Big, huge difference. For instance, blood glucose used to be 70 to 115, you're normal, whereas optimal is 85 to 99. Blood glucose can have an effect on your brain and nervous system. Your brain and nervous system need two things to survive, fuel and activation. Fuel is oxygen and glucose. We'll talk about the oxygen side when we get to the neurological. But here's what we do, I should say. We run a thyroid panel, a complete thyroid panel, just not a TSH, because your thyroid controls all your body metabolism. We run a complete metabolic panel. We run a CBC with autodifferential, looking at red and white blood cells. And we run a lipid panel. Don't tell me you've had normal blood work when, like I said, there are lab ranges and there are optimal ranges. So, we can assess your thyroid, your adrenal glands. Your adrenal glands sit right above your kidneys. They're your stress glands. Liver, kidneys, red and white blood cells, all these internal functions can have a factor in why you're having your vertigo or dizziness or lightheadedness or balance disorder. We're going to run sensitivity testing. We want to check and see if you're sensitive to gluten, milk, soy, eggs, or yeast. If you're sensitive to any or all of those, it could be affecting your balance disorder. Now here are some of the symptoms of these sensitivities. Chronic pain or fatigue, frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers. We're going to look at your adrenal glands via an adrenal stress index. The adrenal stress index is a test. It's a salivary test like a DNA test. And it's taken over the course of a day at 8 a.m., noon, 4 p.m., and 10 p.m. And your adrenal glands can play a factor in your dizziness and vertigo because it plays a factor in blood glucose levels, which can affect your brain and nervous system, especially the back part of your brain and nervous system, your cerebellum. You see, a lot of times doctors will diagnose the patient with BPPV. Maybe you've heard of it. And they'll do something called an Epley's maneuver. Believe it or not, a lot of these doctors do it bilaterally. You should not do Epley's bilaterally. It should only be done unilaterally. We want to look at your immune panels. We want to see if you're autoimmune. You know, I've had dizziness patients where their immune system is attacking their cerebellum. They have cerebellar antibodies. And there's two parts to your immune system, Th1 and Th2. And Th1, you want to check and see if there's a dominance. And the markers for Th1 are something called TNF-alpha and interleukin-2. The markers for Th2 are called interleukin-4 and interleukin-10. If those are high, you're dominant on one side. You see, we want to be as thorough as possible. Most MDs, when they treat a balance disorder patient, and I'm talking vertigo, dizziness, whatever you want to call it, okay, you have a problem. They give the patient meclizine. Meclizine is a medication. Maybe you're taking it, maybe you have taken it. I'm not telling you to stop taking any drugs or medications. And they'll send them on their way. Well, if that doesn't work, what do you do? I mean, what do you do? You've probably gotten this video, or are watching this video, or received this DVD, however you've obtained it, either on the website or with a DVD, because your symptoms are not going away. And if meclizine doesn't work, most MDs are clueless. They'll go in and they'll do surgery and obliterate the semicircular canals, which is nuts. If you're at that juncture, call me. There are other options, and this is what I'm talking about. So, let's say you're Th1 dominant. I'm just giving you an example. Your interleukin-2 and or TNF-alpha are high. What's causing it? Well, it's either caused by an active antigen or dysregulation. An active antigen are parasites, bacteria, viruses, mold, yeast, fungi, protozoan, foods. That's why the sensitivity testing. Chemicals and heavy metals. The best indicator for an active antigen as the cause of a patient's abnormal dominance is the helper-suppressor ratio. It's called a CD4 and CD8 ratio. If it's 2.5 or above, guess what? It's an active antigen. If it's 1.2 or below, guess what? It's dysregulation. It's a problem with anemia, or it's a problem with your blood sugar or your adrenals or something along those lines. But you have to test for it. H. pylori could be a cause, so we check that. H. pylori bacteria in the gut. Intestinal permeability could be a cause. Leaky gut syndrome describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, and or infection. We may check your neurotransmitters. We may check your hormone levels. We may check you for inflammation, or we will, with the C-reactive protein and homocysteine levels. And so what do we do if we find positive metabolic findings? We treat you nutritionally, and we treat you with something called glutathione. Glutathione is the motherlode of antioxidants. So now the neurological side. We do a thorough neurological examination, and I outline it in my book. I have a whole chapter on dizziness, vertigo, balance disorders in my book. And one of the things we do is exercise with oxygen therapy. My first case history in my book is a patient named George. All we did was unilateral adjustment and oxygen with that patient, and he got better after years and years of suffering with balance disorders. So, exercise with oxygen therapy. Oxygen is fuel for your brain and nervous system. Remember I said that oxygen-glucose ratio? As we age, our ability to utilize oxygen decreases by 1% per year. I'm 20. Yeah, right, I'm 20. I'm 50. And from the age of 25, it decreases by 1% per year. So I've lost 25% of my oxygen carrying capacity, or oxygen utilization capacity. It's called oxidative phosphorylation. We're going to use brain-based therapy. We may use vibration therapy. Vibration stimulates the back part of the spinal cord, fires up to the cerebellum. Cerebellum does three things: controls your balance and coordinated movement, controls spinal postural muscles, and it terminates eye movement. It connects with the semicircular canals in the ear via the vestibular nerve. So we want to do a thorough examination of you. You know, when it comes to dizziness, chronic dizziness, vertigo, chronic conditions, I'm sorry, but medicine drops the ball. You wouldn't be watching this video if they've already corrected your problem with meclizine. I mean, they are lost in a lost world. Great for acute conditions, a broken bone, a stroke, a heart attack. But when it comes to chronic health conditions, especially chronic dizziness, chronic vertigo, chronic balance disorders, chronic lightheadedness,